for most people with chronic back pain, and we deal with people that have been having back pain for 30, even 40 years, you can actually get back to an active lifestyle without setting yourself into, an episode or a flare-up of pain.
Welcome to the Wits and Weights podcast. I'm your host, Philip Pape, and this twice-a-week podcast is dedicated to helping you achieve physical self-mastery by getting stronger, optimizing your nutrition, and upgrading your body composition. We'll uncover science-backed strategies for movement, metabolism, muscle, and mindset with a skeptical eye on the fitness industry so you can look and feel your absolute best. Let's dive right in. Wits and Weights community, welcome to another episode of the Wits and Weights podcast. Joining me on the show is Dr. Ryan Peebles, a doctor of physical therapy, to talk about a topic that so many people have experience with, myself included, and that is lower back pain. You'll learn about the deep core and why it's the key to reversing back pain. We'll get into practical strategies on how to recover from lower back injuries, prevent them from happening, and improve our back health. I'm going to ask Dr. Ryan about how things like age, lifestyle, stress, maybe even footwear and heavy lifting impact our lower backs. We'll get into the pros and cons of chiropractic adjustments, physical therapy, and MRIs. I'm personally interested in that one. And we'll learn about his core balance training to reverse back pain. When chronic back problems threatened to take his passion of surfing away from him forever, Ryan committed his life to uncovering its root causes and learning how to reverse them. Now, Dr. Ryan helps thousands of back pain sufferers each year get back to doing what they love without pain. He created a unique movement retraining program called core balance training that is highly successful at reversing back pain through increased core connection. Ryan, welcome to the show.
Hello, Philip. Thanks for having me. I'm happy to be here.
Awesome. So I want to start off with the whole surfer thing because you are a passionate surfer. Not something I'm too familiar with. I grew up in South Florida. We had beaches. You couldn't really surf there, and I never picked it up. But you're a surfer. You almost lost your ability to surf because of your back pain. So tell us about that, and how did that affect your identity?
Right. Yeah. So I started surfing when I was super young. My dad threw me into the water, and it was definitely part of my identity. And it's a kind of an extreme sport on the spine because of the pop-ups. So if you're not familiar with surfing, when you go to pop up off a surfboard, you're kind of doing a cobra, the yoga position of a cobra for a moment, but it's also kind of abrupt. It's kind of forceful. And so the repetitive nature of that backward bending a lot of surfers struggle with lower back pain because of that. If you have tight hip flexors, which I'm sure you and your audience are aware of hip flexors and stuff, right? So that's going to make it a lot worse. And that was the case for me. And so I started getting lower back pain at a really young age. And it got worse. It was probably about 16 when it started and got worse over the next 8 years. To the point where, I had to take about 2 years away. At that point, I felt like I was done surfing, but it was a period of about 2 years where I couldn't surf until I learned some things about my body and got it back into balance.
Cool. Yeah, I've heard a lot of people go through experiences like that. Some people really never figure it out, never seem to figure out how to recover. I've talked about my story here where I actually did end up having surgery. It was a microdiscectomy for severely herniated disc. Whether I had to or not, I'll be curious to see if that's a question I can answer from today. But for me, it was like getting back to lifting, right? So people like to do what they do. They have passions, and we don't want to, give these things up because of something that's potentially fixable. So I do want to talk about the mechanics of this and some specific questions I have. One starts with just this idea of the deep core that you talk about. That it's the root cause. And, my idea of the core is, the trunk and all the muscles and the system that supports that. And I think of that in terms of like isometrics and stabilization, at least when I do lifting. But can you explain what you mean by the deep core and why it's important?
Yeah, definitely. So I wouldn't say the deep core is the root cause. I think it's the solution, actually. Cool. So I can get real deep into the cause, but we'll kind of skip to the fun part and talk about how the deep core can be the solution. It's the muscles that you can't see from the outside, and it's composed of the muscles underneath the six-pack abs, and they tend to wrap around the torso, the flank area around the sides, and it's shaped like a corset. And this is the best design to support the lower back, the lumbar spine. And that's the area of our body, if you look at a skeleton, where there's the least bony support. And you can see behind me, Scully back there, for those watching, the rib cage provides tons of support for the thoracic spine. And then you have the pelvis down below, and that's inherently very stable, but there's a gap between the pelvis and the ribs where it's really just the spine. And so we rely heavily on this corset-like muscle group, which I call the deep core, but it's composed of several different muscles, and you don't really need to know the names, because we don't single out any one of them as the savior. It's not the transverse abdominis that's going to heal your back. They're all designed to work together. And so that's what the program that I teach is about reconnecting with that muscle group and learning how to use it in your everyday life.
I like that you said they have to work together like a system. Again, just making an analogy to lifting weights. People love to talk about muscle groups and individual muscles and individual, isolation movements, when in reality, if you don't have that overall movement pattern down first and that overall strength with it, muscles work together, it's going to be hard to go beyond that, or you might be at risk for injury. So it's funny you said, I was going to ask you the name of the muscles because I'm so interested in what do you call it? It's okay. So a lot of people, and I know we want to focus on the positive, but we have to start with the facts, right? A lot of people suffer from lower back injuries, things like herniated discs. So just top level, before we get into all the details, what's the best way to recover from them and avoid chronic pain?
Yeah, so there's a large percentage of lower back injuries that will end up becoming chronic pain, and there's another percentage of people who will recover and they can move on with their lives. But it's that large percentage that I deal with. It's specifically chronic back pain that we're focused on. And I guess, the best way to avoid it, I was going to break it down into just like in a nutshell, it would be listening to your body. And there's so much more that goes into that, but our body is constantly communicating to us the things that it doesn't like through pain, but also the things that it wants more of through good feelings. And so it works both ways. And if you just do more of what feels good and what's working for your body and do less of what's hurting, like sitting, for example, is probably a pretty safe way to not fall into that chronic category. But yeah, I don't think that there's really something I could just say you got a herniated disc. How do you not let it become chronic without talking about the core?
Okay.
It's such a major part. I think even logically, if people just think about it, there's something to do with the core that is going to be necessary to recover from that. And so that's where all arrows point to for me.
Okay, let's follow the arrows, because you mentioned something like sitting, right? Where I think a lot of people will say that, well, I understand that I've got things that I do all day because I'm working behind a desk, I'm working from home, and I sit. And maybe while I'm sitting, maybe it's not painful, but then there's some pain when I get up, or, I'm stiff and all these things. How do you listen to your body? Because some people, I think, don't have that signal anymore, right? So how do you relearn to do that properly?
Yeah, I talk a lot about this actually on my podcast as well. So listening to your body is actually more than just feeling pain or feeling good feelings. You can get into what you spoke about, where sometimes you have to reflect back because the body often has delayed signals. Mm-hmm. And so, for example, a lot of people will hurt themselves stretching or doing in a yoga class, but they don't feel like they're hurting themselves in the moment. But then maybe later that night or even the next day, their back is tweaked and they just feel off. I think that's a really common experience. And it's not because of what you're doing in that moment. It's because of what you did a few hours ago, or even a day, or even 2 days ago. So there's always this ongoing, this moving period of time where the things that you've done recently affect you now, and it does require reflecting back. Another thing you mentioned is well, we got to sit a lot for work. And I do think sitting is kind of like the enemy, but it's also, to stop sitting is not realistic. And it's also not the solution to back pain, because if it was that simple, I think that everybody would have a standing desk and a lot less people would have back pain.
Are you sitting right now? Are you sitting right now?
I am sitting right now.
Me too. Yeah.
And so, right. So, it's going to be just like a lot of things in life. It's a fine balance, and we have to sit just because of the society that we're in. And so that might require us to do a little more cross training, like focused on things that open up the body, because sitting is a very closed position. It's like the fetal position. And so walking would be a good example of something that kind of is a healthy synergistic movement that opens the body. So to do that in between, little breaks from sitting to go walking. But again, I don't really think for somebody that's already in a state of chronic back pain, that alone is going to be the solution. It's just one step in the right direction.
Hey listeners, this is Philip Pape, and I'm excited to announce our upcoming totally free 21-day challenge starting December 1st. It's called the Wits and Weights No Diet Holiday Body Recomp Challenge. This challenge is about learning how to achieve body recomposition. That's building muscle and losing fat at the same time without dieting or restriction throughout the holidays. I'll be giving you free videos, guides, and personalized coaching in a private group chat to help you enjoy the holidays while being satisfied and guilt-free. The kickoff call is Friday, November 17, and the link to enroll is in the show notes. No matter what episode you are listening to, don't worry. If you're hearing this after November 17, you can still register and get access to the replay and resources before the challenge starts on December 1st. Again, to join the Wits and Weights No Diet Holiday Body Recomp Challenge to build muscle and lose fat without dieting through the holidays, click the link in my show notes. Now back to the episode. Okay, so what are the other steps, right? Because you talked about the core. Do you want to get into that?
Yeah, so a little background on the cause, because I think you do have to understand the cause to be able to understand the solution. So my belief, and you can do your own research, and you don't just trust me right off the bat, but take what you believe. My belief that the cause of the vast majority of chronic lower back pain conditions comes down to muscle imbalances. And so that's just a word or a phrase for when the muscles in your body are the tension and the tone in those muscles are not the way that they really should be. So the hip flexors might be a little bit too tight, and another muscle group like the abdominals might be a little bit lengthened and maybe possibly underactive in the things that you do. And this pattern, there's a predictable pattern of muscle imbalances. The upper traps get tight. The glutes tend to get a little amnesia. We sit on them all day. That's not surprising, right? So this pattern of muscles that are too tight and other muscles that are too weak lead to postural imbalances. And that, if you zoom in really far in the body, if you look at the joints, they just tend to be a little less congruent than they would be if the muscles that are attached to them, those tension guy wires, essentially, were more in balance with each other. And so you can think about a tent. If you had a tent that was held up by guy wires and you pulled some of them too tight and the others you loosened, the tent would be a little wonky, right? Mm-hmm. So that's a similar thing that happens to our body. That affects the joints. They're not as congruent, so there's more friction in the joints. Well, when there's more friction on something like a disc, your L5S1 disc, it's going to wear down a little quicker. And so that could end up being a bulging disc or a herniated disc or a degenerative disc disease. The final event that happens is like the diagnosis. But if you just go upstream a little bit, all of these different results you can kind of find a pattern that they're all coming from this monster of muscle imbalances that we are dealing with. And this is, again, specific to chronic back pain. So yes, you can hurt your back in a car accident, But if you hurt your back picking up a toilet paper roll, it's most likely not the toilet paper roll that hurt your back. It's most likely that was just, to use a pun, the straw that broke the camel's back. And this has been building up for a long time in these muscular imbalances that I'm talking about.
What about the classic situation where, and this is what I went through, where I had, like, when I was 30, just a pop, right? And I was like warming up on squats, had a pop, really painful, went away after a day or two. Years later, came back, and then it got worse and worse till it was like I had a numb leg from, like, sciatica, basically, where I could barely walk or stand. And, had the MRI, the whole thing. And I had herniated disc before, and it was now completely, like, squirted out, so to speak. But I didn't have pain in that entire year. It's just these acute episodes. That's not chronic pain, or can that still kind of be chronic pain? And I just got lucky and didn't feel it because it wasn't impinging the nerve. Or is this a completely different situation?
Yeah, that's a really good question. I would say what you experienced is actually a lot more common than the back problem from a car accident or from picking up a toilet paper roll. Although both of those things happen a lot, the most common one is something in between those two. And so I would consider just the fact that you were warming up, that it wasn't like a 1 rep max, that there was probably something building up to that. Right. And then you went a couple of years without symptoms, and that is maybe it's not typical, but is not uncommon. And part of that could be just because there are no nerves, no pain nerves, no nociceptors inside a disc. So the pain receptors are actually on the surface of the disc and in other anatomy, other tissues of the body. So it may just be that the way that your disc ruptured was not triggering the pain signals until it progressed to the point where it reached that again 2 years later. And then you felt it again.
And then when people tell me about the herniated discs, I hear all different, again, a spectrum of things where it seems that with age, there's definitely some correlation, right? Just natural, I'll call it natural degeneration, but you can challenge that if that's not really true, because there are a lot of correlations we make with age that are not because of age, they're because of other things that happen over time because you're getting older. For example, loss of muscle mass. We talk about our slowing metabolisms. It's not because we're old, it's because we've lost muscle as we age. I've definitely heard the statements like everybody over 30 will show something on an MRI, and almost everything can be healed and doesn't require surgery. And I want to get into all those statements because whether true or not, I want to hear your perspective, specifically herniated disc, but then other things that are very common degenerative issues that cause chronic pain. What's your take on all that?
Yeah, so definitely there is an element of aging. And so with aging, there's going to be natural degeneration, osteoarthritis, stuff like that it's definitely going to occur in all of us. And so you can get to, into the research and find that there's something like, over 50% of people. I actually have it. I'm gonna pull it up while I'm talking here.
Cool.
I have a lot of interesting percentages that would make people feel better about themselves.
Okay.
Because if you're, 35 years old and you have a bulging disc, and you may feel like your spine's a little compromised, and then you find out that 60% of people your age have that same thing, and those 60% of people have no symptoms at all. There's a very poor correlation between these MRI findings and the pain. So I find it one of the most interesting parts of research. So I just pulled it up right now. So disc degenerate. What's your age range? What decade are you in?
I'm 42 exactly. I'll just
okay. So you're in your 40s. So in your 40s, 68% of people with no back pain at all will have degenerative disc disease. 68%.
That's a lot.
Disc bulge, 50% of people in the 40s. And this says 40, so it might be closer to 40. And then let's see, herniated disc, 1/3 of people. 1 out of every 3 people walking around with no back pain at all have a herniated disc. So it's extremely common, and their age is, as you go up in age, Like I can see in the 80s here, 96% of people in their 80s have degenerative disc disease. It's not really a disease, right? We don't
It's
have
the
an
norm, yeah.
infection. It's just aging. But the problem occurs when it's kind of like premature aging, when these problems start happening too early in life and different parts of the body break down faster than they should. Like for me, I was 16 years old. I got my x-ray and the chiropractor who took the x-ray told me that my discs looked like they were 40 years old. So like definitely I felt broken. I felt like something was wrong with me. And so that kind of degeneration happened early for me. And there is a reason beyond age that's related to that. You know, my personal story, yeah, it had something to do with surfing, but it also had to do with the fact that I started lifting weights, heavy weights, bodybuilding style lifting when I was 13 years old. And I created these muscle imbalances in my body that I've now discovered are really common across the population. It's the same pattern of imbalances that bring you into the fetal positions, the same pattern that people are voluntarily going in when they're sitting. So these types of activities, it's not just sitting. It could be something like stress. When we get stressed out, we hold tension in our bodies, right? Well, the tissues that hold tension the best are the muscles. They're the most dynamic tissue in our body. And so that's the only language they speak is tension. So they increase tension, they decrease tension. And when we're tense in our mind, we hold that in our muscles, and there are specific muscles that hold it more than others, like the upper traps, those neck muscles that everybody can feel gets tight. The hip flexors are another one. And all of these muscles are the pattern that relates all of them is that they all contribute to bringing the body towards the protective position, which is the fetal position, which is sitting, which is how it all relates to this. And so, and I know I kind of went off on a tangent there, but
I love it. This is good. Yeah.
That's how your body can age prematurely. And if you look at an old person, they are curling back down, right, into the fetal position, which is what we started life in. We open up, and the goal is really just to stay open for as long as possible.
Stay open for as long as possible. So if we were going to take your 16-year-old version of you who had been lifting weights and then had the surfing, the surfing conditions, the Cobra moves, the pop-ups, right? That, and we also think about humans before modern civilization, for example. What's the difference? Like, is most of this issue with being too closed in, like you said, sitting, a function of modern life? Or would this have happened naturally if humans lived till they were 50, 60, 70 way back when?
I definitely think it's related to modern society.
Okay.
I think back in the day, people moved a lot more. And, there was a point in history when the chair had not been invented yet. And so it's really interesting to think that something that we do probably more than anything else is actually not part of our history.
Right.
And so, there's a lot of people out there that believe, the healthiest thing that we can do is try to mimic what our ancestors did. And I think that I'm probably fall into that category. And there was probably a lot less back pain, a lot less postural, a lot less text neck back then, if you've heard of that.
Yeah.
So, definitely text related.
Yeah. No, I can feel that. So then what did you start doing after you had that accident or that diagnosis of yours that you also do for other people now that helps us get into that better movement pattern? Yeah.
So the first thing I started doing was searching everywhere for a solution. I went to every possible type of healthcare provider, every doctor. I went to countless physical therapists for a 10-year period. I tried everything under the sun that I could think of and find. And the turning point happened when I decided that I had to just stop searching outside of me, and I had to just take responsibility. I realized I wasn't going to find the person that was going to heal me. It was me. That was the only person that could heal me. And so that was my major turning point. And for me, it was, okay, I'm going to commit my life to the body, and I'm going to enter a profession that's dedicated to healing the back. And so that was physical therapy for me. But going through physical therapy school, I wouldn't say was the thing that taught me my solution. What we do in core balance training is we actually model core connection, core development after how an infant and a baby develops their core. Because if you look at a 4-year-old child, they have developed perfect posture and movement without any developmental abnormalities. A 4-year-old child has perfect posture and movement, and nobody ever told them how to do that, right? They don't know what a muscle is or how to contract it or what their names are. They just naturally did it. And that was through their interaction with, really, as an infant and a baby, with the floor and gravity and their body. And their intention was that they just wanted to get up and be like everyone else. And they were pushing away from the floor. And when you're an infant, your arms and legs pretty much have no strength. All your strength is in your core. And so they push away from the floor with different parts of their core. And so we've named these areas of the body. We call them support points. And we model after that. We just simply get down on the floor, and we reconnect to our core through pushing away from it. And then it's a 3-month program. So it's a lot more involved than that. But ultimately what we do is we get familiar with that core connection, and then we apply it to all the functional movements of our daily life, which if for you, if it's, lifting weights, you would integrate that core connection into a deadlift, into a squat. And
how does that work? I'm curious.
Yeah. So the core connection is simply just learning a way to engage your core. Everybody says, engage your core or use your core or whatever, but how do you do that? For a long time, nobody ever taught me how to do that. Like, what was the right way? Do you do it like they teach in Pilates, or like abdominal hollowing, where you bring your belly button to your spine? Is that the right way? Or is it bracing, where you're like, kind of bearing down? What is the right way to do that? And also, like, how intense? Do I want to walk around all day like with a 90% contraction? So that the art of it is really learning how to do it naturally, like in a way that's functional, that you can actually do movements like a 10% intensity activity, like gardening or doing the dishes or something, and have just a subtle level engagement. Is really not something you can teach in words. And that's why I mentioned earlier, like a child doesn't really know. If you said contract your muscle, they wouldn't really know. So it's learned through the feeling. And that's why it's kind of hard to talk about. It's hard for me to talk about. And I've been doing this for 6 years now. The learning happens through experience and through feeling. So you'd have to get down on the floor, and I'd have to say, okay, push away from your back support zone and feel what happens in your core muscles when you do that. Okay, now do that for a few days in a row and get really familiar with it. And then we're going to get up off the floor, and we're going to pretend you're doing the same thing. So pretend the floor is there. You're going to push away from that support zone, but the floor is not really there. But the same core engagement will happen without the floor. And then we're going to do that with a deadlift. So that's kind of how it works in the program. That would be that process would happen over the first month, essentially. It's a long-term, it's a slow solution.
Like many things. I mean, we talk about changing our bodies, even with nutrition, whatever else, it takes time. You got to learn, you got to put in habits, you got to practice, you got to feedback and so on.
The most value that I got from this was the fact that I had someone that I could talk to about anything and that there was going to be no judgment. It was just, well, here are your goals. Here's the best way that you're going to achieve it. And then let's work together to help you feel inspired and motivated to do that. And there's a lot of people out there trying to be coaches, and not all of them have done the work. And also just be a genuine person that is positive and coming from the heart in terms of wanting to help. And Philip really embodied all of those qualities. I would recommend him to just about anyone that's looking to achieve goals in that realm of their nutrition and building new habits.
You have videos though, right? You have a YouTube channel.
Yeah.
Right?
So, I mean, we have a YouTube channel, which is where I kind of just educate on any number of topics, but the actual program is kind of like an online course.
Sure.
It's videos, it's 5-minute videos, and it's one lesson per day for, there's 12 weeks worth of modules.
Okay. Yeah. So we'll definitely put that in the show notes. I want to ask a few more questions about some of the causes too, because you mentioned stress. And I remember when I was going through my back issues, somebody recommended a book to me by someone who had his whole philosophy was about the mental side of, you might even know who it is. I can't remember his name.
John Sarno, Healing Back
There
Pain.
you go. There you go. I don't know what your thoughts are on him or on that. I didn't pursue it too far because it didn't seem necessarily applicable to me. But anyway, go for it.
Yeah, so that is one of the books on the recommended reading list for all students in the program. I've got probably like 4 books on this list. And so that's one of them. It's a pretty big deal. So Dr. John Sarno teaches that all chronic back pain is actually mental, and that it's, he calls it TMS. And so he named it. And so it really relates the mind and the body. Now, do I agree with him? Not completely. I think there's a major physical aspect to back pain, but it's very eye-opening for people to even just be introduced that the idea of the mind-body connection could actually be that strong, that stress in your mind could cause back pain. And I think there's definitely truth to that. I just don't stand in the extreme side of the court that I say all back pain is from that. I often say that 90% of the solution to back pain is mental. And that's because, we're doing physical things, but so much of what we're doing requires focus. And I think a lot of the great athletes and trainers would say the same thing about their sport or their activity. I know that's probably what I just watched the documentary on Arnold Schwarzenegger, and he was talking about that. That is that his bodybuilding was actually mental, and the body, you change the shape of your body with your mind. Right, there's lifting weights involved, but there's just such a huge component of the mind in doing that.
I agree 100%. I wanted to bring this up because when I read that book, my wife and I then looked up the documentary he had made, which is hard to find because it's not like you could just stream it. You know, they were just case after case after case of people who they were in such pain, they were on the ground with their legs up most of the day, that kind of thing. And they dealt with it mentally, but definitely, again, when I think of lifting weights, for example, I've definitely come around to the idea that the physical is just the tail end of like the chain of effects, right? You've got to have the mental, whether it's resilience or focus or mindfulness while you're doing it. And I could see how all of that is tied together, and people listening, just be open-minded about all of this because what you're saying makes a lot of sense. And if you haven't found a solution, then, there's something else that's got to work for you. It's not like it's hopeless.
Definitely. I mean, I read John Sarno's book when I was struggling, when I didn't have a solution. And it was a turning point for me. Just, it was such a massive eye opener that I have it on my reading list, right, for all of my students. But did it heal my back pain? No. It's just something, it's another step, just like what we were talking about with sitting or cross training to reduce the effects of sitting, it's not going to heal you completely, especially if you have a long history of chronic back conditions, but it is a big step in the right direction. And if you do enough of those steps with different elements, you can definitely, no matter what's going on, you can definitely improve your life to the point where tomorrow is better than today. And you can, for most people with chronic back pain, and we deal with people that have been having back pain for 30, even 40 years, you can actually get back to an active lifestyle without setting yourself into, an episode or a flare-up of pain. It's just improving that relationship with your body. And it's a journey that doesn't end. You keep going. You keep learning every day.
Really good for people to hear. You can improve every day, and part of it is opening your mind to improving your mind and thinking positively and taking that action. And all, like you said, not one thing is going to solve everything necessarily, but they all come together and maybe spiral on each other. I wanted to ask about, so getting into solutions, people think about, one of those is chiropractic. Okay. Yep. I've never been to a chiropractor. I've thought about it, but tell me your thoughts on about that. I'm totally open-minded. Are they worth it? Do they provide relief? Do they make a difference? Does it matter based on the chiropractor?
Well, I'm going to start off by saying that people think I hate chiropractors, and I don't. I've had one of my greatest mentors was a chiropractor. So it's all up to the individual, and like in any profession, there are good ones and there are bad ones. And so if you're going to go to chiropractic, my best recommendation is to do your research, look at the reviews on the person, hopefully go to someone from a good referral, because the problem with chiropractic is it's possible that, if you get a bad one, like I did, when I was probably around 22 years old, they can hurt you. It can hurt your body if they do something that's too extreme. And typically, if you have a herniated disc, the underlying nature of that kind of condition is instability. The tissues that connect the vertebrae are compromised. And when they're compromised, that means they're not holding it together as well as they would, right? So it's not as stable as it would be if the tissues were fully intact. And so typically you don't want to manipulate, you don't want to thrust an injured tissue like that. And the good chiropractors know that. They won't do that. And they use different kinds of techniques, and they adjust other areas of the body. But when I was 22 years old, a chiropractor gave me a strong thrust into my injured vertebrae, and that sent me spiraling for years. Actually, it really messed me up. Okay. And so that's why I had a really bad experience with a chiropractor in my life, and that's a true story. And I always just tell people, do your research. But there are good ones out there, and they are able to help you get, be a catalyst for getting, improving your body. But again, as I said in the very beginning of the show, the solution is not outside of you. It is not somebody else. It only can be you. And it only can be you improving the way that you use and operate this body that you live inside. And that's my strong belief. There is no other solution to back pain. Even if you get surgery, you still have to do the work to improve the way that you use your body.
And that's empowering too, right? Because it means we have control over it. Your example of the chiropractor as a catalyst made me think of, for example, these new GLP-1 agonists for people to lose weight, right? It's like a catalyst maybe if you've, struggled, but then you got to do the work.
Right.
Spoke to a person who on my podcast came out today. He had bariatric surgery years ago, and he's like, it's tough. If you're going to do that, you got to go through the work. So I like that it really comes down to you, your choices and your control, but you have to know what to do, which is a guy like you here telling us some of that, what we can try. So what about two other areas would be massage therapy and physical therapy. So obviously you're a physical therapist, so we'll end there, but massage therapy, what do you think about that?
I think everybody should get massage because It improves blood flow to the muscles. It makes you feel good. If you can afford it, it's a fantastic thing. Some massage therapists can get a little aggressive, and if you have an injury, it would be very wise of you to let them know before getting the massage.
I can attest to that.
Yeah. So, I mean, I got one, I think it was 2 days ago, and it was actually pretty aggressive. And I even told him, I was like, I have a history of back problems. It's all good now. Just want to let you know. And he was doing some like thrusts on my spine. I was like, in the middle of the massage, I'm like, hey, it's okay. I don't need that. So just to set some boundaries around your body. Don't stay quiet. If they're messing with one of your injuries and it hurts, speak up. They don't know. They can't feel, what you feel. But other than that, I think massage is a fantastic thing for, all the reasons. Even if it's just because it feels good, that's healthy for your mind, right? And which is healthy for your body. So, Is it the solution to back pain? Probably not. No. But again, that's the theme of
that's within your body. Yes. Yeah. I was just wondering. Yeah.
Go ahead. So physical therapy. So I'm a physical therapist, right? So naturally, I would have a bias towards my profession, and I will be the first to say that it's actually not that effective for chronic lower back pain. I did ongoing physical therapy for about 10 years when I had my problem. And I got better each time. I would go for, 12 to 16 visits and then get discharged and then start the cycle again. And each time I would probably get a little bit better. And then as soon as I stopped, the problem would return. And so I think there's a gap with physical therapy where the exercises and the hands-on treatment become the solution. And I don't think that's enough, because when you get off that treatment table and you leave the clinic, with those other 23 hours of your day, if you're just living them the same way that you did before, and I mean literally like walking around in your body, bending over, doing the things in the same way, then that's so much more significant than 30 minutes or an hour on a treatment table. And so I think that the gap with physical therapy is that there's not enough emphasis on integrating the way that they teach you to use your body into activities of daily living, of the tasks that you do, the mundane things that you do to get through your day every day. And that's where I think that you can have a long-term solution and not be dependent on exercises as the things that will keep you out of pain.
I've never heard it put that way, and that was really clear. The idea that 23 hours of our day, when we're not in physical therapy, we're basically reversing or worse what happened in physical therapy, and then that's only for 12 sessions, right, or 16 sessions, and the rest is gone. So I've never heard it put that way, but I know personal experience with physical therapy, I was always feeling like it wasn't enough or there wasn't much going on, And then even when I did the exercises, you're right, it's just like these discrete, moments rather than, hey, there's this overall movement pattern you need to work on. Like you said, the moving like an infant and dealing with your back that way.
Yeah. Well, moving, developing like an infant.
Yeah. Understood.
But I really don't like the whole 3 sets of 10 thing. And it's so common in physical therapy, but I will also say the same thing. It's there's good ones and there's not so good ones, and the best physical therapists are doing what I'm talking about. They're doing movement patterns, they're doing movement retraining, and they're telling you the things that will last beyond walking out of the clinic door.
I like how you're speaking movement patterns, because again, just tying it to lifting, because that's what I know.
Yeah.
When I did CrossFit and all sorts of other things for years that were fun, they were athletic, but they didn't make me a lot stronger or help with my muscle mass. And then I learned about movement-based strength training, right? Which a lot of the compound lifts kind of fall in that category where we start thinking systematically. So I like where you're going with that. You mentioned MRIs before, and I don't know, we didn't really get into it the level I wanted to, but how effective are they? Should people get them? Are they misleading? What are your thoughts?
So I think they're necessary because they need to be able to rule out something like a cyst or a tumor or stuff that we can't see that could be going on the inside. And so they're important. However, I think that the way that we use them is not the most beneficial for the vast majority of back pain patients, because what happens when you have back pain, you get an MRI, you find out you've got, a degenerative disc or a bulging disc or a herniated disc, like in your case. Oftentimes we get the report or we talk to the doctor, and then we feel a little broken. And that is not good for the mind, because when we feel broken, it actually changes the way that we move. There's a name for it. It's called fear avoidance behavior. And so a lot of people can develop aberrant movements where they'll bend over to pick something up in a different way that's more kind of protective or trying not to hurt themselves. And then we'll also avoid activities. We'll avoid, maybe we won't go play that pickup game of basketball. And so that is, as a single event, it's not that big of a deal, but it accumulates and it spirals into, okay, now I'm not going to do that activity anymore either, because my back's not feeling very good. And then, you don't use it, you lose it. Your body adapts to this less active lifestyle, and you continue to go in the downward spiral of back pain. So I do think MRIs are important, but I think it's important to educate people, like what we were talking about earlier, about how common the conditions are and how they're very poorly correlated with pain. Because remember, those percentages I was giving you earlier were all for people that have no symptoms, no back pain. And so there's a poor correlation. And sometimes there's people with severe back pain that have none of those conditions. There's the MRI is unremarkable, but they have severe back pain. That exists, and it's not uncommon. So to educate people, if you're going to give them the report, and then also I think there is something to be said about maybe just not actually giving people the report if there's no red flag, if there's no reason to believe that there might be cancer in there or something, and say, your spine is relatively normal, and we recommend you being a little more active and getting some physical therapy to treat the pain that you're feeling. But there's nothing really about this MRI that makes you broken or different than the rest of society.
Sure.
And then that won't have the effect on people of feeling broken and then acting different and behave and moving their body as a broken body. They can feel that confidence, which really, I've made an entire YouTube stream about this. It really improves the health of the way that you move when you move confidently versus in fear.
It's all in the mind. It really, a lot of it is in the mind. It's funny because, again, my own personal experience with the surgeon I had, the first time I had an MRI, it showed a herniated disc, and he said, you know what, this is fine. Like, it's fine. 10 years later, as I had really bad pain symptoms, he said, well, now it looks like you probably need some intervention, which, again, for my unique case, that may have been the case. But for the 60-something% of people in their 40s who have some degeneration without pain, then you have people with pain without degeneration in their MRI. Logically, then there's an overlap of people who have pain and have something in their MRI, but that may not be causing the pain.
Right. It's more of a correlation and it's not causation because, again, there are so many outliers. And I think that the way that you had that experience with your doctor was respectable. And I'm sure that there's a lot of radiologists and doctors out there doing it that way. And I hope that that's a trend, because it's not the way that I experienced healthcare when I was going through my problems.
So how many people who have a herniated or bulging disc can heal it without surgery? Like, is there a number in your mind that, is it, 95% of people? Is it half? Is it everyone? Like, what are your thoughts on that?
Definitely, I don't know, but if I had to guess, I would say probably north of 80%. And maybe we'll just go with the 80-20 rule because it's so prevalent.
I'm not going to hold you to it. No.
Yeah. And I think that even with people that get surgery, there's so many people that actually get a second one and third one. And I mean, I know multiple people that have had 6 microdiscectomies, and it's because, the surgery doesn't heal the disc either. It's just removing a torn piece of the disc that might be pushing on a nerve in most cases. So regardless of the surgery or not, I think the solution has to happen. And the only time I would recommend getting surgery is if the pain is so bad that it impedes the ability of you to do the actual solution. The core connection. If you can't get down on the floor and do it because the pain's so bad, that's when I would get surgery. And then also, if there's motor nerves involved, so if you're experiencing paralysis in your foot or ankle or your hip, that would be definitely a case for getting the part of that nerve that's compressed, just to remove whatever's compressing that nerve.
And then as far as the healing goes, is the movement pattern training that you do the primary part of this, or is there an extra element of, say, strength training or something else on top of it?
We don't use weights. So the program is heavily focused on just developing the core connection, and then we apply it to functional movements. So once, those first 4 weeks are people feel confident with the core connection that we teach. We start to apply it to standing and hip hinging and deadlifts and squats. And then we get into these other functional movements that train hip rotation and thoracic spine mobility. But the way that we leave people off in the program is we kind of usher them into applying this into the things that they love to do. Okay. Because really that's the motivation for a lot of people is like, I can't do this anymore. For me, it was surfing. And that was my motivation to get my body healthy, is so that I could surf again. So to apply it to what you love to do, whether that be weightlifting or running, or yoga, we actually, I'm a big believer in yoga. So I kind of end the program and say, like, this is how you would apply all this stuff to a yoga move. But yeah, I will say that I think yoga is the best for healthy people who have their bodies in balance. And if your body's really out of balance, you can definitely hurt your back trying to do a yoga move that your body's not ready for. Sure. So, yeah.
Sounds like just about any movement can be until you train it. So what about, last thing is, what about other pain in other areas? Since you deal with the low back, if you have shoulder issues or hip issues, does this tend to resolve some of those, or is that kind of outside your scope and there's other approaches for those?
Yeah, so the focus of the program is definitely lower back pain, but what we've found over the years is that definitely we have this side effect of people telling us that their knees are getting better and their hips are getting better and their neck feels better. And it's not surprising because we're addressing the body as a whole and we're improving the posture of the whole body. And those muscle imbalances, that same pattern, it's a predictable pattern of muscle imbalances, and I often refer to it as the monster, is underlying a lot of knee pain conditions too, like patellar tracking disorders, where the patella is actually just in the groove a little laterally and it's causing a lot of friction. Well, guess what's pulling it laterally? A tight muscle on the outside of your leg. And so that's a muscle imbalance just zoomed in to the knee. And so it's that same pattern of muscle imbalances that we're just generally improving. And yeah, it does tend to make people feel better in other areas that they didn't really expect.
Another good reason we call it the core, right? It's core of everything.
Right.
All right. So I there's a hard stop in about 5 minutes here. So I want to ask you the question I ask all guests, and that is there any question you wish I had asked you, and what is your answer?
Oh man, that actually puts me on the spot because nothing's coming to me right now. No, I can't really think. You covered a lot, and I thought you had some really good questions. So cool. I don't got anything for you there.
That works. All right, man. So where can people learn about your program and your work?
So you can go to corebalancetraining.com. You can go to YouTube and just search Core Balance Training. We're all the same names on Instagram, Facebook, whatever. But I think the best resource that I can recommend anybody is the masterclass. I just took all the most kind of valuable information that I could, and I tried to pack it into the smallest video possible. So it's 15 minutes. It explains with illustrations what I was talking about, the underlying muscle imbalances that often lead to chronic lower back pain, and then the solution that I believe is the best way to long-term address this muscle imbalance and get back to doing an active lifestyle.
Awesome. I will add all those in the show notes, and your approach is refreshing and makes a lot of sense to me. Always looking for solutions to this because it is so prevalent, and I really appreciate you coming on the show, man.
Yeah, thanks for having me, Philip. Really appreciate it, and look forward to checking out more episodes of your podcast.
Yeah, man, check it out. All right, thanks for coming on.
All right, you're welcome.
Thank you for tuning in to another episode of Wits and Weights. If you found value in today's episode and know someone else who's looking to level up their wits or weights, please take a moment to share this episode with them. And make sure to hit the follow button in your podcast platform right now to catch the next episode. Until then, stay strong.